and welcome back to That's What She Said. My name is Mercy. Hope you all are doing good. Today on this episode, I have someone very special, mainly because I would say this person was one of the reason I got my confidence back. We have orthodontist and director at Opel Dentistry, Dr. Kirubaharan with us. Welcome to That's What She Said.
Hi. So thanks for having me here. I like the warmth of the place. As always, your warm smile too.
Thank you, and thanks to you, I got the smile. This is a story that I have to tell people who are watching and listening. You know it already. I had a bit of a crooked tooth, and I was always not so confident. And even though I was in the media field, I was in a radio. If anybody tells me let's do a video, I would shy away because I'm like, I'm not confident. And to be sitting with you and doing a podcast on camera almost feels great, because I remember in 2018 is when I came to Opel, and I thought, I'm too old to be fixing my teeth now. And you said, no worries, we can fix it. And you actually fixed it. And thank you so much for that, doctor.
Thank you.
Let's start with the podcast, right? Like I said, I remember in 2018 when I came, Opel was a small clinic in Nungambakam, and now you guys have expanded like crazy. You have a clinic in Bangalore, Hyderabad, Coimbatore. How did Opel really happen?
I actually never wanted to start a clinic because I had not worked in any clinic. I was going as a consultant to a few other clinics, but I have not been working in any clinic. So I just want to take some time and then to join some practice to work. But I always wanted to deliver the exact result that we want. But when we travel and we consult and practice, it is not possible to deliver the exact result that we want. So then actually clinic happened. And when we started, it was very, very, very small practice.
Yes.
It was 246 square feet.
Yes, I remember that. Yeah.
And we had to mask the narrowness of the clinic by placing a huge mirror on one side.
Okay.
It was good, and we started in 2016.
Okay.
Then we branched out in our second clinic in 2018. We had a new clinic.
Okay.
Then we branched out to Bangalore. Bangalore was our first outstation clinic, because usually in dentistry and in medical field, most of the doctors will have their branch clinic in the same city.
Correct.
Probably one of the very few who have in other cities.
Right. Oh, nice. That's lovely, actually. When I was, prepping for your podcast, I was just thinking, how do people get into dentistry, right? Like when, let's say, I haven't met anybody who, when I was growing up, I'm saying, people would say, I want to become a doctor or maybe an engineer or something. How did dentistry happen to you?
I actually never wanted to become a dentist.
Okay.
I was forced into dentistry.
Okay.
I never wanted to take up any computer-based job.
Okay, that you were clear.
Yeah. So in those days, everyone becomes an engineer.
Correct.
Right? So I never wanted to do that. I want to be in some people-facing job. I badly wanted to be a psychologist.
Okay.
So psychology was my passion. I badly wanted to be that. Unlike every other good Indian parents.
Yeah.
So I was kind of forced into dentistry.
Okay.
First year, I was not interested in the subject.
Okay.
And third year is when we entered clinicals.
Okay.
So that's when we started facing patients to treat them.
Right.
So that's when I got more interested in the subject too.
Okay.
Then by the end of BDS, I was very clear I wanted to be an orthodontist.
Okay.
I was like, I'll either do orthodontics or I'll not do any PG.
Okay. Oh, lovely. That's great.
So I chose orthodontics for actually two reasons. Because the way you can influence people, one, and you get to treat all the young patients.
Yes.
In our college, we have all the departments. When we enter, say, surgery department, most of the patients there are with the pain or to address the pain.
Correct.
So the mood of those departments will be different. And in orthodontics, it's to enhance their smile.
That is true, yeah.
So they have not come there to address their pain or any suffering. It is just to uplift.
Yeah.
So the entire mood of the place is nice.
Yeah. That's very interesting, no? Like actually when you think of a doctor, he you always think of, okay, people are coming to fix their issues. It's very interesting that you said the mood of the place itself is different because they are there for another reason, which is really nice. I was watching this podcast recently, actually, someone who was doing it with a dentist, and this person was talking something about an oral microbiome. What is that? Can you tell us a bit about it?
Again, mouth is the starting point for the gut, right? So it belongs to the gut.
Right.
Like our gut, it also has huge amount of bacteria, and these bacteria are very important because they actually form a shield for us.
Okay.
Right? We have 600 crores of bacteria at any point of time,
Oh my goodness.
and actually most of them are good.
Okay, that's good. Okay. Huh.
So even if you see cavity, any cavity causing bacteria are normally found in everyone. Right?
Okay.
It's when we allow them to act more, so they increase in the number, and these bacteria release acids,
Right.
and that erode and corrode the teeth. That's why you have cavities.
Okay.
See, cavities are actually formed because of the bacterial invasion of the teeth.
Okay.
So we usually think again sugar act directly. It actually doesn't.
Yeah, sweet சாப்பிட்டா வந்து சொத்த பல்லு வரும் அப்படின்னு
Correct.
சொல்லுவாங்க.
Sweet, yes.
Huh.
It causes, but not directly, indirectly. So
Okay.
it feeds this bacteria.
Okay.
And then bacteria increases. So then it causes.
So it's because of the gut you're getting that.
No.
Okay.
It's like, again, the bacteria are there. When you have more of sugar,
Okay.
so these bad bacteria increase in number.
Oh, okay.
And they actually release acid. And those acid, they erode the teeth.
Okay. Okay. Wow, interesting. I didn't know that.
It's actually not about the amount of sugar you take. It's about the frequency of sugar you take. Say
Okay.
you have a chocolate bar. If you're eating it once, it doesn't affect that much. If you break into pieces and
Oh.
having it every 10 minutes,
Oh, okay.
that frequency affects the tooth most.
Okay. Okay. Can you tell us about how oral health improves the overall health, right? I also, when I was prepping for this podcast, I saw how your oral health is also related to your gut health and also to an extent your heart health, like
Correct.
overall heart issues and stuff. How is oral health connected to these things?
We usually think the gut and our digestive system as a grinder, that it grinds everything that we eat. It is not. All of the grinding action happens only in the mouth. After this, actually no grinding happens. So the food is only being attacked by an acid and then dissolves enough and then mashed here. And all of the grinding happens only in the mouth.
Okay.
The main function of the teeth is to chew and eat. The chewing is the starting point of any digestion.
Okay.
Again, the way we chew and the efficiency that we chew matters a lot in the gut health also.
Oh, okay. So you have to chew your food enough.
Chew well and eat.
Okay, okay. And what about the heart-related issues? How is that related to oral health?
So again, going back to your question about oral microbiome, right? We swallow our own saliva. So even every time you brush, the bacterial count in your blood increases.
Okay.
Even when you normally brush, your bacterial count in the blood increases, not your it alone, mouth
Okay.
alone.
Okay.
If you have bad bacteria in your mouth, that can reach your heart through the bloodstream.
Okay.
And these bacteria can settle down in the heart walls. And these bacteria can settle in the wall. That can cause inflammation there.
Okay. All right. So let's say, for example, this is the question that I wanted to get to. Basically, Niket, what he believes is that we always wake up in the morning, we brush our teeth, and then go about having our breakfast or coffee or whatever. He always says, finish breakfast. After finishing breakfast, or half an hour kaichu palu thechittu, ore adiya you clean your teeth and then leave for the day. What are your thoughts on it? When do we actually brush?
It's actually good to brush as soon as you're up.
Okay.
Right?
Why though?
The exact reason is that you have to have at least half an hour after you brush not to have anything to eat. eat or drink. It's good to have it.
Okay.
It's not must. You're actually not supposed to have any food soon after you brush.
Okay.
Your paste has some fluoride molecules, and they need some time with your teeth.
Okay.
Right? That's one.
Okay.
So each time you eat, your pH of your oral cavity reduces to acidity. Right? So it's always good to have half an hour of buffer time after or before you eat.
Okay.
So even if you're brushing in the night, I would prefer you to brush half an hour after you eat.
Okay. Okay. So I think you have your answer now. You better start brushing as soon as you wake up. Yeah. Okay. So let's talk about braces, right? Something that actually truly changed my life, I would say. But right now there's a lot of options, like one being Invisalign. Uh, First question is, when is the right age for anybody to get a braces?
Again, the main function of braces is not to enhance the smile. It is to align the teeth to again make sure the coordination between your upper teeth and lower teeth are the best.
Okay.
Right? So the actual right age to start meeting your orthodontist, I don't say for every patient we need to start early,
Okay.
but for few patients we need to start much early, around the age of 7 or 8.
Okay, that
So,
early we can.
Yes.
Okay.
We have to plan your treatment much early because few areas we have to act only around the age of 12 to 13.
Okay.
And few areas we have to act much early. So if I have to expand the jaw, so the jaw expansion is actually better achieved.
When you do it early.
Correct.
Okay.
So around 8 to 9 age is actually a good time.
Okay.
So it's actually good to meet your orthodontist much early to plan your treatment early.
What about Invisalign? Like, do you think Invisalign is for everyone, or only a certain set of people with like minimal corrections can go for Invisalign?
No, I believe 98% of our cases can be addressed with Invisalign, and maybe 80 with exclusive Invisalign, and rest 20 can be handled with the hybrid model,
Okay, what's that?
where we do 85% of your treatment with aligners,
Okay.
and only for 15% we'll have some braces fixed
Oh, that comes towards the end or towards
towards
the
the end.
Okay.
Mostly it's towards the end or somewhere in the middle.
Okay. Okay.
So the idea is to use the best out of both to achieve the right results.
Okay.
So again, the goal is to not to do somehow to address it with aligners. The goal is to reach the right area and the
Correct.
best smile.
Correct.
And we use hybrid method to follow that as well.
Okay, so when you mentioned how braces are not used just for smile correction, but it's also for jaw alignment, right? Is there any like case that you have handled where, let's say, the smile is almost fine, but the jaw alignment is not right? How does a person know that you need to get it checked?
Yeah.
Is there any warning sign?
The main warning sign with that we often ignore is the headache.
Okay,
And these headaches
I have a lot of headache. Okay.
and these headaches are very typical, and they come around your eyes and one sided. So if you keep your hands like this, you have a fan shape area. So all these are muscles that are related to your joint.
Okay.
So if you have all these things are the sign that your joint is not good. And if your joint is not good, it's called TMJ joint. It's a joint that connects your lower jaw onto the skull.
Okay. So, like, how early does that warning sign come, or is it for different people?
Actually, the joint has a way of accommodating the issues. It will not give you pain until the age of 25. We typically see most of our patients having this headache around the age of 25 to 28.
Okay.
It starts around that age and it gets much worse in the early 30s.
That's actually very interesting, right? Like, we think it's only about smile, it's only about just the beauty, but then it's crazy that it has such an impact. But like, let's say if you don't address it, what's the worst that can happen?
You will again face the incoordination issue, like headaches, and you will have joint pains, and your chewing efficiency drops down. If it is not addressed now, around the age of 40 and 50, you will start seeing wear faces in the teeth.
As in?
So
What is
wearing
that?
wearing down of your teeth.
Oh, okay, okay,
So
okay.
imagine, so if it is like a wheel,
Okay.
it runs smooth like this. If it is slightly missed,
Right.
so it will wear down these areas,
Oh, okay.
and
Okay.
that's exactly what happens.
Okay, okay, interesting. Let's talk about veneers, right? Something that a lot of people are getting it done because it's just faster. Uh, what's your thought on it? Like, is it safe to do it, or like, only a certain people can do it?
It's very safe to do veneers.
Okay.
And again, veneers, it needs to be chosen based on what do we need and where do we start from.
Okay.
So if you have to change your color, shape, texture of your teeth, then veneers can be done
Color,
Right.
shape, texture. Okay, okay.
of your teeth.
Ah.
But if you have to change the position of the teeth, right, again, that can be done only with braces or aligners. So if I want to change the angulation of the teeth, so if I have to push it backwards, then it can be done only with braces
Yeah.
or aligners. But if I have to change the size by increasing the size, I cannot reduce the size, but I can increase the size with veneers.
Okay.
So veneers are like a wafer of ceramic. It's placed on the teeth.
Yeah.
We'll have to shave a layer of your teeth off, around 0.2 mm, and then add this artificial layer on your teeth.
Okay.
Right.
Okay.
So I wouldn't say veneers can be done for everyone. So
Yeah.
if you already have a weaker enamel, that might not be possible for you.
Okay. And how long does it stay though? Veneers.
Veneers, if done well, it lasts very long, until 20 years also.
Oh, okay. But after that, you have to go for another
Other
maintenance
veneers.
sort of a
Correct.
sitting. Okay. Okay. 20 years, huh? Interesting. Okay. What's the impact of coffee on oral health?
Again, coffee has two issues here. One, every coffee, if milk is not added, is acidic. Right.
Okay.
So again, I would ask everyone to reduce the frequency of intake of coffee because it's an acidic drink. So like your Coke.
Yeah.
Right.
Correct.
So it has the ability to slightly dissolve your enamel and make it more vulnerable for all this bacteria to attack them.
Okay.
And also about the coloring. Right. So it can discolor.
Okay. And what about sodas? Does it have any impact?
Definitely yes.
So without it's just sparkling water, not
Sparkling waters are fine.
just sparkling water. Plus,
Okay. What?
you should
Like
choose your
sparkling water and sodas almost taste the
Sodas-
same to me. It's still fizzy, right?
No,
No, but-
sodas are acidic.
soda
Acidic.
is different.
Okay.
Yes, sodas has two issues. One, they're acidic, very acidic, and two, they have sugar in them. Right?
Even plain sodas. I'm talking about plain soda.
Plain sodas,
Huh.
they all are acidic.
Okay, okay. So that's not good for your
Not good.
oral health. Okay. Let's talk about whitening strips, right? That's going viral on Instagram. Every time I'm getting advertised a whitening strip or a whitening pen these days that you can
Whitening
get it and do it. Would you suggest it? Is it legit?
If you ask anyone who have used them, right, no one will be happy about it because it actually doesn't work.
Okay, okay.
So all these are not good for you for two reasons. Because again, it bleaches your enamel. Any uncontrolled bleaching, it can make your teeth whiter today, but in a short while, it will make the enamel more porous.
Okay.
It's like if you have a tile, it doesn't get stained that easy. But if it's a marble,
Yeah.
it can get stained. So it can convert your teeth from being a tile to being a marble. Right? So it can attract more stains, and that's actually not good. So it does the opposite of
Whitening.
bleaching. In a long
Yeah,
run.
okay.
Most common misconcept about brushing is that if you brush more, it'll be more white. Actually, the opposite is true.
Oh.
You brush more rigorously, and you erode the layer of enamel out, and the next layer is yellow in color.
Okay.
So if the enamel thickness reduces, enamel gets into transparency.
Okay.
So it reflects the color from inside.
Okay.
So
So,
it-
how often do you think is
Twice.
Twice is a must for sure.
And your brushing should not be more than 3 minutes.
More than 3 minutes.
3
Okay.
minutes.
Okay. Tell us three non-negotiables, right? Everyone should do to have a good overall oral health.
Yeah, brushing is one. You have to brush your teeth every morning and night. That's actually basic. And doctor visit once a year. It
Any issue
helps.
illa nalu.
Correct. Correct. Because you have these deposits on the teeth, right? So all these are deposits from the salts from your own saliva.
Oh.
So again, once these deposits are formed, you will not be able to clean it.
Okay. Okay.
So you need a professional cleaning to be done at least once a year to again make sure you don't have any deposits.
Got it. So would you say scaling every year is suggested?
Yes.
Okay.
Uh, Again, once in a year scaling, I would not blanket tell everyone needs it, but a doctor visit once in a year is mandatory.
Okay. After that,
And your
the
doctor might
can.
not decide to do either scaling as well.
Correct.
Plus, I would ask you to reduce any sugar intake and the frequency of sugar intake.
Huh. Got it. Okay. So these three things. So sugar is clearly a problem for mouth, for body,
Yeah.
everything. Let's talk about mouth taping, right? Something that again people are doing and stuff. Has it got anything to do with oral health at all, or that's a completely different thing?
It has got nothing to do with the oral health as such, but it improves your breathing. So it kind of forces you to breathe through your nose.
Yeah.
It is actually good. We do something called oral screen.
Oh.
Oral screen is usually for kids. We do the exact thing like an appliance it is placed on the mouth.
Okay.
So it encourages them to breathe
So it's
through
like
the nose.
You give that
Like a
device to
plastic
them?
which is placed in between the lips.
Okay.
So you will be kind of forced to breathe only through the mouth.
Okay. So do you give this to adults as well? Because if we have issues,
It
is
is
that
usually done for kids.
okay? Because I think we all clearly have that
Can be
mouth
done for
breathing
adults as
issue.
well.
Can be done.
Can be done.
Okay. It's got something to do with the jaw biting as well, right? Like I feel like actually my sister, she's been telling me lately, I actually wanted to come and visit you because of that, but she came only for a week and she left. She's been having this
Jaw clenching at
jaw
night.
clenching, especially towards the night. In the night, she's having that. Why do you think that's happening?
I spoke about the incoordination between upper and lower jaw, right?
Correct.
This is the resultant of that, right?
Okay.
So if your mouth finds some irregularities in your clenching, it tends to clench fully at night, and your jaw clenches very hard. You will kind of wake up with the headache in the morning. So the jaw muscles are all sore in the morning,
Yes.
and you'll wake up with a headache in the morning itself.
Okay. So,
So
what would you suggest for this?
braces or aligners would help, or if any faulty crowns are there, we have to change the crowns. So when your biting apparatus is not good,
Okay.
it results in these things.
But the interesting thing is she's had braces for almost 3.5 years, like when she was in her college. Which means, so even after putting braces, there can be misalignment, is it?
If your braces treatment is inadequate, or if you have not worn your retainers after that,
Okay.
so all these can contribute to this.
Okay. Let's say someone has a very poor dental hygiene, right? What's the worst that can happen out of it?
The worst can happen in which your chewing is compromised. So you kind of tend to eat softer things. And by nature, softer things are not good for your health,
Okay.
right? So if you have a salad, that's again hard to chew. So
Yeah.
anything good is not soft to eat. So they tend to eat soft things. That's why you see most of these patients having diabetes.
Okay. Okay.
So it's not directly influencing there, but it has a indirect influence over your eating habit.
Got it. So it's a long-term
Correct.
issue that you might have later on if you do this. Okay. Does stress impact oral health?
In a huge way. We see anyone who have been having any chronic stress typically would have a gum disease. That's kind of early onset. We see people around 20 and 25 who have some shaky teeth only because of stress.
Okay.
And one theory is that stress increases your cortisol level, and the cortisol weakens your immune system,
Correct.
right? It's kind of put you into a place like you have a diabetes. You actually don't have, for according to the mouth, it will act like any bacteria are enabled to invade your gum.
Okay. So the immune system becomes
Immune
weaker.
system weaker, and they have loose teeth as well,
Okay.
even at the age of 20, 25. So stress have I'm talking about clinical stress here.
Right.
So it's not the work stress that everyone has.
Right.
So again, stress plays a huge role in the gum health as such.
Okay. Okay. All right. Cool. Let's move on to the next section. We have myth or fact. I'm going to give you statements. You can tell me if it's a myth or a fact, and you can even explain it. If it's a myth, why is it a myth? If your gums bleed while brushing, you should stop brushing that area.
No, myth.
Myth.
See, if your gum bleeds while brushing, which means the gum is inflamed, right? Inflammation is like it's already swollen.
Right.
And the inflammation is because that area has some retentive of your food or something. So it's always good to floss that area, allow the bleeding to happen for a while, and then it will recover, or meet a dentist.
Okay.
So every time your gum bleeds, it's time to meet a dentist, because the earliest sign of any gum disease.
Okay.
It's the first sign of any gum disease is to have the bleeding. So you have to meet a dentist as early as possible. And again, if you're not brushing that area, you're encouraging more of that to happen. And then it will only increase the issue there. It will not solve the issue.
Correct. Good. Also, I wanted to ask you, how important is flossing?
It is not mandatory that you have to floss. I don't floss every day, but it's actually good to floss at least once or twice a week, where you have time for yourself at night.
Okay.
If not in the morning, at least the night before you sleep. I would prefer anyone flossing their teeth at the end of the day than in the morning.
Right.
It helps better, and you'll have even more time for yourself in the night.
Correct.
So at least twice a week,
Is,
it helps.
myth or fact, chewing sugar-free gum can help prevent cavities.
True.
Really?
True.
Oh, okay. I didn't know this. Okay.
Not any sugar-free gum. Any sugar-free gum which has an element called xylitol.
Okay.
So these are found to act against cavities.
Okay. So we need to look for that
Yes,
ingredient.
xylitol
and
gums.
Okay, interesting. You only need to see a dentist if you have pain or a visible problem.
Absolute myth.
Okay.
You have to meet a dentist at least once a year. In US, it's once in 6 months, but at least once a year helps.
Yeah, okay. I don't think we have seen, you have seen a dentist in,
Once in my life.
we have to go. You should replace your toothbrush every 6 months.
Yes, it's better you change every 3 months or 4 months as well. The efficiency is better if it is changed every 3 to 4 months.
Okay, so that's advisable.
Yes, yes,
Flossing isn't necessary if you brush well.
yes,
Abdiya?
yes.
Oh,
So flossing is not a must. It is good to do it.
okay.
So again, flossing is good, but it is not a mandatory that you have to floss.
Okay. Charcoal toothpaste is the best for whitening
No.
teeth.
No.
Okay, before even I finish, he's like, no. Okay.
So it's again because of the particle size of the charcoal paste. It gets more abrasive, and then that erodes the layer of enamel.
Oh, and then comes
That
the yellow
makes
layer.
again porous.
Correct. Oh, so it doesn't make sense, right? Like how people are marketing it in a different way is just sad. Bad breath is always caused by poor oral hygiene.
Not always, but yes.
Okay.
It's not always, because and your bad breath can start from your mouth or from your gut as well.
Correct.
Right. Most of the time that we see, it's from the gut as well.
Okay.
So it's both ways.
Using a straw can help prevent staining on teeth.
Little bit,
Okay.
but not entirely true. But it helps a bit.
Okay. Wisdom teeth always needs to be removed.
Not always. One, if your jaw has enough space. So it's actually has a evolutionary point of view as well.
Okay.
Right. Again, 100 and 200 years back, we were eating more hard and gritty food.
Right.
So we had well-developed jaws. Right. As we cook and eat, as our food habit changes, right, we tend to eat softer and softer food. and over the years the jaw size has slowly reduced.
Okay.
And there is actually no need for the extra teeth, so it doesn't have space to come out.
Okay.
So it's always angulated. If the angulated teeth is hurting the next teeth, we have to remove. But even now, if you have a good sized jaw and your wisdom teeth can erupt, and it can be maintained as well.
You can keep it.
Yeah.
Okay. So let's talk about tongue cleaning, right? How important is tongue cleaning? Do we have to do it every day after brushing our teeth? Is it necessary to be doing it every day?
It's not mandatory that you have to clean every day, but at least twice or thrice in a week helps.
Okay. So, but it's an important process.
Yes.
Okay. They also say that if your tongue is, if your tongue has like a white sort of coating, like you have a lot of bacteria. Is that true?
Yes. So all these can act as a bed for the bacteria to grow and increase in number as well.
Okay.
That's true.
I wanted to ask you about toothpaste, right? There's a lot of different kinds of toothpaste on the market. We just spoke about charcoal toothpaste as well. But there's a lot of herbal powders that's come and herbal toothpaste. Which one would you say, is there any ingredient that we need to look out for in a toothpaste? Which ones do you think is a good one?
So paste is actually, it's a soap for your teeth.
Correct.
So the important most ingredient that in a paste, it's its ability to foam and lather.
Correct.
Right. So it cleans your teeth by foaming up. One is that. Other one is the particle size of the paste.
Okay.
So all this helps to clean your teeth better.
Okay.
And I would definitely not advocate any herbal powders here because of two reasons. One, all these particle size are not regulated. So usually it gets more abrasive and you'll have enamel loss for sure. The worst part is that combining both your brush and the powder, it gets worse.
Right. Okay, wow. That's interesting because the herbal powders are at an
Yes.
increase right now, right? And people are like, oh, herbal is the way to go and stuff like that.
And one more important ingredient in the paste is fluoride. Again, fluoride helps to protect your teeth against cavity. And it's been proven. So for your teeth, fluoride is good.
Okay, all right. You're a specialist in Invisalign, right? So is there any like age limit for a person to get Invisalign done, or you've treated anybody old? Is there a story?
So the oldest patient that I've treated is 81-year-old patient.
That's crazy.
Sweetest lady and just very regular with the eyeliner wear.
Okay.
It's always a joy to have her in the clinic every time she walks in.
Okay.
Such an energy she has.
That's lovely. But what was her reason? Was her reason cosmetic or was her reason the jaw alignment?
Cosmetic.
Oh, wow.
And when she came to me, she was like, all my life, I never liked my teeth.
Okay.
I heard something like Invisalign is there. I never liked braces to be in my mouth.
Okay.
I want to have it treated.
Oh, wow, such a joy, no? To have that motivation at that age.
Seriously.
To look a certain way is lovely.
And she's extremely regular with her eyeliner wear.
Okay.
Every time she walks in with a lot of energy.
Okay, but that's crazy. Yeah, so that actually says that there's no age limit.
Correct.
To get a...
Anyone who has good bone around their teeth, it can be done.
Okay.
So you can be 30 years with poor bone support. Invisalign might not be done.
Okay. And what's the youngest you have done?
Youngest
Invisalign
patient
for?
is 7-year-old.
Oh, okay.
Invisalign is a way of treatment, right?
Yeah.
So it is done for different people for different reasons.
Right.
And for the kid, it's only expansion of the jaw.
Okay.
Right? So the arch coordination is better achieved at the younger age.
Correct.
Right? And for this lady, it's purely cosmetic. And for few of them, we do exclusive for the joint health alone.
Okay, but that automatically translates to cosmetic as well?
Yes.
Okay.
Yes.
All right, cool. So I think we've almost come to the end, and before I leave, I always leave with a word. Do you know what odontophobia is?
Fear of dentist?
Fear of going to dentist.
Going
You
to
almost got it right. I think one of the very few people who got the word of the day right, because I always say the word and the other person doesn't know it.
I know this word specifically because this is exactly what we addressed Opel dentistry.
Correct.
So if we see the white walls around you, one main thing is that Opel dentistry, it doesn't smell like a dental clinic, because most of the fear comes from either the claustrophobic room of the
Correct.
dentist, one, and two, the smell of dentistry. So in all these senses, so it should be pleasing for the eyes.
Yeah.
So you will see green in my clinic,
Yeah.
all whites.
Yeah.
So the issue that we are fighting against is this.
Odontophobia.
Odontophobia.
Yeah. It's more welcoming, definitely. Yeah, like I've gone to the clinic multiple times, and it's a place where, like, you feel like going. You're not very scared to go, and with that, I think it's almost come to an end. And it was lovely having you here. And like I said in the starting itself, it's a full circle for me to be doing this with you, getting my confidence back after I got my tooth fixed. Thank you so much, doctor, for coming on That's What She Said. It was lovely having you.
Thank you for having me here.
All right. With that, it's time for me to leave. And like I always say, be good and do good.